Did you know that 1 in 4 adults over 60 dismiss symptoms that could be quietly signaling something serious? Hi there. As we get older, our bodies do change. There's no denying that. But some changes aren't just normal aging. They're red flags. Today, we're talking about 10 symptoms you absolutely shouldn't ignore, because catching them early could make all the difference. Let's start with the first 3. First up, unexplained weight loss. Maybe you've noticed your clothes fitting looser lately, even though you're not dieting or exercising more. That's not something to celebrate just yet. Losing 5% of your body weight in a year without trying can be a sign of underlying issues, like thyroid problems, diabetes, or even certain cancers. So if your scale's dropping and you're not sure why, it's time to call your doctor. Next, let's talk about pain that won't quit. You might think, oh, my knees have always ached, or it's just a headache. But persistent pain, whether it's in your joints, chest, or head, is your body's way of waving a big, bright flag. For example, a constant headache that feels different than usual could signal anything from dehydration to something more serious. Don't just reach for the pain relievers and hope it fades. Get it checked. And here's one we often brush off: sudden changes in vision. Maybe you've noticed flashes of light, dark spots, or blurry vision that comes and goes. It's easy to blame it on tired eyes or a new glasses prescription. But sudden vision changes can indicate retinal issues, glaucoma, or even a mini stroke. Your eyes aren't just windows to your soul. They're windows to your health. So if something looks off, don't wait. Now that we've covered these first 3 symptoms, let's move on to the next ones so you can stay informed and proactive about your health. Now, let's dive into 3 more symptoms that deserve your attention. The fourth, shortness of breath during everyday activities. Maybe climbing a few stairs leaves you winded, or you feel like you just can't catch your breath while folding laundry. It's easy to chalk it up to getting older, but sudden or worsening breathlessness could point to heart disease, lung issues, or even anemia. Your body needs oxygen to thrive, so if your lungs or heart are struggling, don't shrug it off. Next, let's talk about fatigue that sticks around no matter how much you rest. We all have tired days, but if you're constantly drained, even after a good night's sleep, it's worth digging deeper. Persistent exhaustion can be a sneaky sign of conditions like thyroid imbalances, depression, or vitamin deficiencies. You've earned your relaxation, yes, but you also deserve energy to enjoy it. If your get up and go has gotten up and left, talk to someone who can help. And here's one that's tough to admit: memory slips that disrupt your daily life. Forgetting where you put your keys. Normal. Struggling to recall recent conversations, getting lost in familiar places, or feeling confused about routine tasks. That's different. While occasional forgetfulness happens, significant changes in memory or thinking could signal conditions like dementia or even vitamin B12 deficiency. Your mind is precious. Don't hesitate to protect it. Let's keep this conversation going. Up next, we'll tackle a few more symptoms that could save you or a loved one from bigger health challenges down the road. Now, let's get into the final 4 symptoms that could be whispering or shouting for your attention, starting with dizziness or balance issues. If you're feeling unsteady on your feet, or the room seems to spin when you stand up, don't just blame it on a bad day. Sudden dizziness can signal anything from dehydration to heart problems or even a stroke. You deserve to move through your day with confidence, so let your doctor help you find the root of it. Next up, chest pain or palpitations. Now, I know what you're thinking. Chest pain? That's obvious. But here's the thing. It's not always a dramatic, clutch your heart moment. Pressure, tightness, or a racing heartbeat while resting can be subtle signs of heart trouble. And ladies, this isn't just a man's issue. Heart disease affects us all. So if something feels off in your chest, please don't wait. Call your provider. Another symptom we often hide: changes in bowel or bladder habits. Maybe you're rushing to the bathroom more often, seeing blood, or struggling with constipation that won't let up. It's easy to feel embarrassed, but these changes can point to infections, diabetes, or even cancers. Your body's rhythm matters, and it's worth a conversation, no matter how awkward it feels. Finally, swelling in your legs or feet, a little puffiness after a long day. Normal. But sudden or severe swelling could mean circulation issues, kidney problems, or heart failure. If your shoes suddenly feel too tight, or pressing a finger leaves a dent, don't just prop up your feet and hope it passes. Get it checked. Look, friends, our bodies talk to us. And the more we listen, the better we can enjoy the years we've worked so hard to earn. So if any of these symptoms ring a bell, take that first step. Call your doctor, grab a loved one for support, or jot down notes to bring to your next appointment. You've spent a lifetime caring for others. Now it's your turn. If this resonated with you, share your story in the comments below. Let's learn from each other. And if you found this helpful, hit that like button and subscribe for more straight talk about thriving at any age. Remember, getting older isn't about slowing down. It's about knowing when to pause, when to act, and always choosing to savor the journey. Here's to your health, your strength, and the wisdom that makes every year a gift. Take care and keep shining.